Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Today in Neighborhood Health Watch, innovative treatment methods in joint replacement surgery. Arthritis is a source of pain for millions of people and can lead to disability. Doctors say joint replacements such as hip and knee replacements can improve a person's quality of life. There's a greater demand now for improved techniques and implanted parts that are more durable, mostly because many of the people seeking joint replacement are now younger. Dr. Cyrus Kump with Parham Doctors Hospital is here to talk more about the improvements, but give us some comparison to start out with, and if you could debunk some of those myths.
I think you're exactly right, Diane. Debunking the myth of what joint replacement used to be and what it is and can be now is what is important. We used to think of joint replacement as a process where it was a long surgery and you spent a week or two in the hospital, and nowadays these surgeries are done within an hour or two with certain new techniques, and we have people only stay in the hospital for 1 or 2 days. In fact, some situations patients can be out of the hospital the same day or leave the hospital.
That is amazing. What are some of the new techniques that excite you?
Well, for hip replacement, the primary one is the direct anterior approach, in which there's a smaller incision, which means less violation of the tissue around the joint. It also decreases our risk of complications during the surgery and even the complications after the surgery that we would standardly see with the older procedures.
And those parts that we just saw in the video there, how does it translate into maybe fewer infections or reducing complications after surgery?
Right, so you know, several complications could occur with the older materials or the older designs, and over the last 15 to 20 years new designs have come along and new materials that will make these prostheses last longer. Of course, we have to follow people for a number of years before we can absolutely prove that, but we feel like we've solved a number of problems that we had with the newer designs, with new metals, new plastics, and how they're developed and processed.
All right, Dr. Cyrus Kump, thank you so much for sharing the information. It's exciting. We appreciate you being here.
Thanks for having me.